Tonight, are rainbow peoples invisible to healthcare professionals? Hi everybody, welcome to GayTalk Tonight. I'm Andrew Whiteside. Well, my guest is Michael Stevens. He's the author of a new report calling for greater cultural competency around the health needs of queer people in New Zealand. The report makes 5 policy recommendations: that LGBT people receive equitable and culturally safe access to healthcare, all health services should be supported and resourced to deliver that care, that tangata takatapui have their health needs considered in line with Treaty of Waitangi obligations, that rainbow communities be actively involved with and consulted about the development, delivery and evaluation of healthcare policies, programs and services, and that priority be given to researching the health needs of the rainbow communities. Michael, welcome. Thank you for coming.
Thank you, Andrew. Great to be here.
First up, congratulations. Wonderful piece of work. You must be very proud.
Thank you. Yeah, I am. It does feel good to have it out. Yeah.
In a nutshell, why was it necessary to do this?
Because the public health needs of our communities have never been looked at before in a national way. And this is something that became apparent that we needed to do.
My reading of it is there's still a lack of visibility for LGBT people in the medical profession, in that wider industry, and some of our needs still aren't being met. What do you think specifically are the issues facing us when we're accessing or not accessing healthcare?
I think that word you just used there, visibility, I think is core, because you can't tell that somebody comes from our community simply by looking at us. So a lot of people go through the health service without ever declaring that they are bisexual, transgender, transsexual, gay, lesbian, whatever, because of old historical reasons. They just don't feel comfortable, they don't feel safe. So the medical system isn't aware that we come through it in these numbers and that they need to consider our cultural background and how that influences our health.
Do you think that how this manifests for some people is that they don't disclose information that could be relevant to a healthcare professional, and or they're simply not also accessing healthcare that they should be because they're afraid of how they're going to be treated?
Yeah, both of those factors come into play. I mean, certainly some of the research around mental health needs for people from our community show that a lot of people have had a negative experience with clinicians, and so when they go back to a different health service, they don't disclose. So there's no reason to assume that doesn't happen in the wider health sphere as well. In fact, we're quite confident it does.
Is it possible to quantify it, or are we just using qualitative methods at this stage?
One of the demands in this report is for us to be included in data collection. So we have a lot of good qualitative data, we have a lot of anecdotal data. We need to be included in quantitative statistical data sets as well. And that's one of the calls that we make in this report in terms of policy, that our community should be included in all sort of future national health surveys that take place. And that researchers should consider us when they're drawing up their research proposals and designing their research tools.
And I guess this is a dilemma too, isn't it? Because when governments are deciding to allocate scarce health resources, they look at research, they look at the numbers, they look at the dollars, etc. So if we're not represented, it's almost chicken and egg. If we haven't got the information, then we're not going to be represented, and so on. How do you get past that?
That's exactly right. And well, one of the figure we've used in this report comes from the Australian figure. So the Australian Federal Department of Ageing recently put out a report on the need for aged care for LGBTI elders, and their figure was 11% of the population is somewhere under that rainbow umbrella. And now if that's 11% of the population in Australia, it's going to be about the same here in New Zealand. We're not getting 11% of the funding. We're not getting 5% of the funding. We're not getting 2% of the funding or attention. So this gives us a case to say, you need to pay attention.
In terms of people ageing, I was interested to see that there's this notion of we don't want to be put back into the closet. Is that a genuine concern that as people enter old folks' homes or whatever, suddenly their gayness gets dropped So what are your thoughts about that? What are we seeing?
That is a real concern, and that quote actually comes from a lesbian. She made this comment about 2 years ago, and I remembered it, and I checked with her a few weeks back, and she was happy for me to include it in the report still. It is a fear for people. If you go into aged care, what if you encounter staff who come from other cultures who don't understand our culture, our way of being? Sometimes family members can also start to step in and go, no, we don't want you doing that, or trying to cut off access perhaps to your partner or your husband or your wife. These sorts of issues. So aged care for our communities is becoming an increasing issue, and around the developed world it's something that more and more people are paying attention to, and it poses its own set of problems.
And I guess it does come back to that invisibility, doesn't it? And the assumptions that people are heterosexual.
It always seems to come back to this, I think. It is this assumption that everybody is heterosexual and everything is built around that. In fact, when we have a distinct and different culture, we can see within our world, what does a transgender person have to do with a gay man, have to do with a lesbian? We can see the differences that separate us. The outside world lumps us together. And we do have a set of shared experiences in terms of the oppression and the bullying and just the marginalisation that we experience.
I guess within that culture as well, there are differences. So a self-actualised lesbian or gay male may be accessing the services they want. If they get an attitude or don't receive what they believe they should, they're probably more likely to stand up and say, hey, I need this. Somebody who's in the closet or someone who's further marginalised may have difficulty with that.
I think it's very much the case. And also you could come from a position, for example, of being perhaps a very confident gay man in a major city and then move for some reason to a small town area and suddenly find you can't find a doctor who understands anything about being gay, and you might actually feel like you have to go back in the closet when it comes to discussing your health needs, or have to make special trips away to an urban centre to get the kind of attention you need. So there isn't a universal, consistent standard, and that's something else that we need to be aware of, and that should exist across New Zealand. And I believe that can only happen by the health system understanding that just as they need to be aware of issues of cultural competency for Māori, for Pacifica peoples, and increasingly now for our Asian immigrant populations as well, they need to see that we have a culture and that their staff need to be basically culturally competent in dealing with people coming from rainbow communities.
How confident are you that what you've identified in the report will actually come to pass, that there will be a change? Because I imagine it's not going to be easy.
Bringing about change is going to be a long-term process, and it's going to be slow, and I would imagine it's going to be very much layer by layer and steadily building it up over time. What is really encouraging is the way the Auckland District Health Board has been so supportive of this work. So this report is actually the final output from the LGBTI Wellbeing and Suicide Symposium that the Auckland District Health Board sponsored earlier this year. The CEO of the District Health Board has been extremely supportive of this work. So it's encouraging to see people in high places like this taking these matters on board and treating them seriously. That gives you some degree of hope. That's one District Health Board. What happens in the ministry, what happens with other district health boards is another matter. But we've got some powerful allies who are on side already, but it will be a slow process.
So in conclusion, what's the most important thing that people can take away from reading this report?
The 5 policy recommendations within the report with their accompanying action points, they provide a really good way forward, and it would be extremely gratifying to see any government or any political party commit to implementing those policies and those action points.
Well, Michael, that's fantastic. Congratulations again, and thank you so much.
My pleasure. Thank you for having me.
Thanks for watching Gay Talk tonight. I'll see you again very soon.